Welcome to our guided journey into delirium, led by Dr. VTR Ntsanwisi. Whether you're a patient, a loved one, or a healthcare professional, understanding delirium is crucial for recognizing and managing this challenging condition. With the stethoscope symbolizing attentive care, we'll break down complex medical information into clear, relatable stories and analogies, making the science of delirium accessible to everyone. Delirium is like a sudden storm in the mind, striking quickly and causing confusion, emotional swings, and even hallucinations. It's not a disease on its own, but a syndrome with many possible causes, making it unpredictable and sometimes reversible if caught early. Most importantly, delirium is a medical emergency. Recognizing the signs promptly can mean the difference between recovery and lasting effects. Diagnosing delirium is a bit like detective work. Understanding what's behind the sudden change in a person's mental state is crucial. According to medical guidelines, delirium can be classified based on its cause or etiology. For example, it might be triggered by a general medical condition, such as an infection or organ failure. Sometimes it's the result of substance intoxication. Think of someone who's taken too much medication or used recreational drugs. Other times, delirium appears during withdrawal, when the body is adjusting to the absence of a substance it's grown dependent on, and in some cases no clear cause is found, which we call delirium not otherwise specified, or NOS. Identifying the underlying cause is essential because it shapes the treatment plan and can make a real difference in how quickly and fully someone recovers. For both patients and healthcare professionals, recognizing these categories helps guide the next steps and ensures the best possible care. Clinicians rely on specific criteria to diagnose delirium. First, there's a noticeable disturbance of consciousness, meaning people may seem less aware or unable to focus and shift their attention. Next, there are changes in thinking or memory that aren't due to dementia. These symptoms develop rapidly, often over hours or days, and usually tie back to a medical issue or substance effect. Let's look at the key features you might notice during an episode of delirium. People may experience sudden changes in consciousness, sometimes hyperactive and restless, other times withdrawn or apathetic. Disorientation, memory problems, jumbled speech, vivid hallucinations, mood swings, and even a flipped sleep-wake cycle are common. Spotting these warning signs early can help ensure timely and effective intervention. When someone is experiencing delirium, there are often distinct neurological symptoms that can serve as important clues. These include incoordination, where movements become clumsy or unpredictable, and dysphagia, which affects speech and understanding. Tremors or involuntary shaking may appear, while asterixis causes sudden lapses in muscle control. Imagine a brief, uncontrollable hand flop. Ataxia leads to unsteady movement, and apraxia makes it hard to perform familiar tasks, even when muscles are strong. Recognizing these symptoms helps guide timely care. Delirium isn't just about outward behavior. It's rooted deep within the brain's chemistry and wiring. Key neurotransmitters like acetylcholine and noradrenaline play vital roles in attention and alertness. When their balance is disrupted, confusion can follow. Anatomically, the reticular formation in the brainstem and the dorsal tegmental pathway are especially important for regulating wakefulness and awareness. Think of these areas as the brain's control center for staying oriented in the world around us. Delirium is surprisingly common in hospitals. About 10% of all hospitalized patients experience it. The risk jumps to 20% for burn patients and 30% for those in intensive care or with AIDS. It's also more likely in the very young, the elderly, or anyone with a history of brain injury or previous delirium. Interestingly, men are affected more than women. These numbers remind us how crucial it is to watch for delirium in vulnerable groups. The causes of delirium are wide-ranging, falling into two main categories: disorders of the central nervous system and systemic illnesses. CNS disorders include events like seizures, traumatic brain injuries, strokes, or bleeding in the brain. On the other hand, systemic illnesses can trigger delirium through infections, trauma, dehydration or fluid overload, nutritional deficiencies like low thiamine or vitamin B12, burns, severe pain, or heat stroke. Recognizing these root causes is essential for effective prevention and treatment. Certain medications and even common over-the-counter remedies can contribute to delirium. Pain medications such as pethidine or morphine, antibiotics, cardiac drugs, antihypertensives, anticholinergics, antineoplastics, anesthesia agents, dopamine antagonists, serotonin syndrome triggers, and steroids are all potential culprits. Don't overlook herbal teas or nutritional supplements either. They're not always harmless. Awareness of these risks helps both patients and healthcare teams spot problems early and adjust treatment safely. Delirium can also arise from a variety of medical conditions. Endocrine issues like Addisonian crisis or thyroid problems may trigger it. Blood disorders such as anemia or leukemia can play a role. Renal failure, hepatic encephalopathy from liver dysfunction, brain tumors or metastasis, drug intoxication or withdrawal, and exposure to toxins like heavy metals or aluminum are other contributors. Understanding these categories helps us look beyond the obvious and provide comprehensive care. Understanding the causes of delirium starts with looking at three key areas: metabolic, cardiac, and pulmonary. Metabolic issues like hypoglycemia or hyperglycemia can disrupt brain function, especially when vital ions such as sodium, calcium, or magnesium shift up or down. Heart problems, including heart failure, arrhythmias, or recent surgery, also play a major role. And finally, lung conditions like COPD or low oxygen levels can trigger delirium. Recognizing these categories helps tailor effective treatments. A thorough physical exam offers vital clues for diagnosing delirium. For instance, a slow pulse, bradycardia, might point to increased intracranial pressure or hypothyroidism, while a rapid pulse could signal infection or heart failure. Fever may indicate underlying infections or thyroid issues. Changes in blood pressure, whether low or high, hint at shock, Addison's disease, or even encephalopathy. These physical signs guide clinicians to the root causes of sudden confusion. Next, let's look at breathing patterns and their meaning. Rapid breathing, or tachypnea, might result from diabetes, pneumonia, or metabolic acidosis. Shallow breaths could be a sign of alcohol intoxication. Checking the carotid vessels for abnormal sounds or weak pulses can reveal risks for transient ischemic attacks. And any evidence of head trauma, like bruises, could indicate traumatic brain injury. Each finding paints a clearer picture of what's happening inside the body. Examining the eyes, mouth, and heart can offer crucial insights into delirium's underlying causes. Swelling in the eyes, papilledema, might suggest a tumor or severe hypertension. Dilated pupils can mean anxiety or even delirium tremens. Injuries inside the mouth may point to seizures. When it comes to the heart, irregular rhythms could raise the risk for blood clots and reduced oxygen delivery to the brain. Every detail matters in piecing together the diagnosis. Physical exams also include checking lungs, breath odor, liver, neck, and thyroid for hidden clues. Lung congestion can reveal pneumonia or pulmonary edema. A whiff of alcohol on the breath may signal intoxication or withdrawal delirium. A fruity smell could mean diabetic ketoacidosis. An enlarged liver hints at cirrhosis or hepatic encephalopathy. Stiff neck suggests meningitis or bleeding in the brain, while a swollen thyroid points toward hyperthyroidism. Each sign leads us closer to understanding and treating delirium. When evaluating a patient for delirium, a careful neurological exam is essential. Let's walk through some key signs. Asymmetry in reflexes or a positive Babinski's sign may point to conditions like stroke or dementia. An abnormal snout reflex can indicate frontal brain problems. Issues with the sixth cranial nerve, such as lateral gaze palsy, might signal raised intracranial pressure. Hemiparesis often suggests a mass lesion or cerebrovascular disease. And don't overlook autonomic hyperactivity. This could reflect anxiety or delirium itself. To uncover the root cause of delirium, a thorough laboratory workup is vital. This means checking blood chemistries, including arterial blood gases, electrolytes, and glucose, as well as liver and thyroid function. We also screen for infections like syphilis and HIV, test urine for drugs, and assess the heart and brain with ECG and EEG. Imaging studies such as chest X-rays, CT scans, and MRIs provide more clues, while vitamin levels and spinal fluid may reveal hidden deficiencies or diseases. Managing delirium starts with understanding the patient's story, gathering a detailed history, and observing behavior changes. Physical examination and laboratory investigations help pinpoint the underlying cause. The goal is to address not only symptoms but also triggers, whether it's an infection, medication side effect, or another medical issue. By combining these steps, history, behavior control, exam, labs, and targeted treatment, we create a personalized plan that supports both recovery and safety. Beyond medical treatment, supportive care plays a critical role in managing delirium. Ensuring physical safety is the first step. Sensory support means preventing both too little and too much stimulation. Think of it like finding the right volume on a radio. Familiar environments and regular sitters can comfort patients. Tools like calendars and clocks help maintain orientation. And for those recovering from cataract surgery, preventing black patch delirium is key to supporting healing. Pharmacotherapy is sometimes necessary to manage severe symptoms in delirium. Haloperidol can be used for psychosis, while lorazepam helps with agitation or insomnia. For patients with Parkinson's disease, quetiapine or clozapine are safer choices to avoid worsening movement problems. And if alcohol withdrawal is the culprit, medications like diazepam or Librium are effective. The choice of medication always depends on the individual's needs and underlying conditions. Distinguishing delirium from dementia is crucial for proper care. Delirium develops rapidly, within hours to weeks, and attention fluctuates dramatically, with changes in alertness and awareness. Speech may become incoherent and sleep-wake cycles reverse. In contrast, dementia unfolds slowly over months or years, with stable attention but gradual memory loss and word-finding difficulties. Recognizing these differences ensures patients receive the right support at the right time.